Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then, role of endoscopy in upper GI bleeding. So, what is the role of endoscopy in upper GI bleeding? So, whenever the patient comes with the upper GI bleeding, the first investigation which should be done is endoscopy, because endoscopy is very important for diagnosis and for the management um, of the upper GI bleeding. So, early endoscopy is the what is early endoscopy? If the endoscopy is done within 24 hours, this is called as early endoscopy. And in the early endoscopy will actually reduce the requirement of blood transfusions, because once you do an early endoscopy and if you find the bleeding vessel, you can cauterize it or you can ligate it, and you can do treatment through endoscopy itself. In such cases, it will reduce the risks of requirements of blood transfusions. It will also decrease the need of the surgery, and it will shorten the hospital stay of the patient. Okay, so overall, in 20 to 30% of patients, so overall, if you see, among all the patients who undergo endoscopy, only 20 to 35% of patients require therapeutic endoscopic therapeutic intervention. Only 20 to 35% requires therapeutic intervention, and among those who require therapeutic intervention, only the 5 to 10%, only 5 to 10% will require surgery. So there is, among all the patients who undergo endoscopy for upper GI bleeding, most of them will the bleeding controls on its own. Only in 20 to 35% of patients, therapeutic endoscopic intervention is done, and among them, only 5 to 10% of patients require surgery. If you were asked what is the best tool for localization of the source of the bleeding, so localization of source of the bleeding is done by endoscopy. Then, in 1 to 2% of patients presenting with upper GI hemorrhage, 1 to 2% of patients presenting with upper GI hemorrhage, the source cannot be identified. Why? Because of the bleeding which is present, the source cannot be identified in 1 to 2% of the patients. And one more important thing is, if we have to plan a procedure, even before planning the procedure, first and foremost, it is very important to resuscitate the patient. That is, you should give aggressive lavage of the stomach should be given with normal saline before proceeding to the before doing a procedure, because first you should resuscitate the patient and you should give a lavage to the stomach, so that all the hemorrhage or all the bleeding which is going on will decrease, and as a result it is easier to do the procedure.
thank you and thank you for watching.